I'm Nancy Collop. I'm currently a professor of medicine at Emory University, where I run the Emory Sleep Center. And my path to sleep medicine actually started as a medical student when I worked in the sleep lab of Anthony Kales. At the time, he had one of the first sleep labs in the country, and they were doing research on hypnotics and what have you. And they were looking for medical students that would help come in and hook up the patients for the sleep studies. And so one of my co-medical students was doing this. He was a year ahead of me. And he said, "Oh, you should come do this. It's a very easy money." And so that's kind of how I got into sleep medicine, ironically. And then got involved in a few more research projects as a medical student. And then kind of liked it. It was unique and it was different. And so I decided to do internal medicine. And during my internal medicine residency, I did a little research project on trying to figure out what was the main effect of CPAP, whether it was increasing end expiratory volume or the upper airway, stenting the upper airway. And then kind of fell from there into a fellowship with Jay Block at University of Florida, who was one of the early sleep researchers, of course, in sleep disordered breathing. And so that's kind of how it all started. It was kind of a fluke, really. So I think my first sleep meeting was, probably 1992 after I had got on my fellowship. And I started, I guess, really with testing in the American Board of Sleep Medicine. I got involved in that early on. And then was interested in education and training. So I was put on the fellowship task force because in the beginning, the AASM was accrediting fellowships before it became, mainstream with ACGME. So those were the kind of first two entrees into being involved with the academy. Okay, so when I first started practicing sleep medicine, it really wasn't a specialty at all. It was kind of either run through a neurology program because people were doing EEGs, or it was in a pulmonary program. Early sleep labs were testing for sleep apnea. Everything was on paper. We had huge reams of paper that people now can't even imagine probably how that worked. And, it was kind of a sideline business. Like, patients would come either through, the different specialties with their different complaints. And so over the course of my career, it kind of became more solidified as a real specialty. And like the very first sleep lab that I worked in was a 1-bed sleep lab. It was across the hall from my office, So it was quite different. And then, as more interest developed in sleep medicine, through the different specialties, it kind of started to grow, and then sleep labs started to become more popular, and the growth has just kind of exploded, really, since that time, or certainly over my career. Yeah, so I think the sleep board really started way back, many years ago, and one of the people I work with now, Don Blywise, was like one of the first people to get certification in sleep medicine. It was like a bunch of people sat around and made up an exam, and then it started there. I mean, because you figure if you have a field, you have to have training and a test. That's kind of the way medicine is. And so it kind of started from there, and then I got involved in the I guess the early 90s, and it had evolved to the American Board of Sleep Medicine. And at that time, it was a 2-part exam. There was like a written part and then a practical part, and it was very labor intensive and 2 different committees, and it was really quite interesting. And so I got involved in that and kind of worked my way up through and became the president of the American Board of Sleep Medicine. And there was always this yearning to make it more mainstream, right? Because we were like called a rogue board. And so there was a push to go and lobby to the American Board of Medical Specialties. And I went to several meetings and we were thwarted for many attempts. And then eventually what really pushed it, and I think this was during your tenure, what really pushed it was the fellowship side. So the fellowship also had kind of driven through the academy accrediting fellowships. And then the ACGME said, oh yes, we'll go ahead and let there be sleep medicine fellowships. And then the ABMS said, well, because they have this relationship, it's like, well, we can't let them have fellowships without us doing the test. And that's kind of when we got their interest. And so then there were a lot more meetings about trying to make that transition to becoming, part of the American Board of Medical Specialties exam. And then that actually happened. I helped write the application to the ABMS, and then it happened, and I got to be a member of the first ABMS sleep certification. So it was kind of a nice progression over time to get to that point. And it was quite a journey to get there. Yeah, I would say during my tenure on the board, the most common question I was asked is, if I have my ABSM certification, should I take the other exam? Yeah, so that was by far and away the most common question that I got. The answer was yes. You should take the other one because you just don't know. And I think I think most people did. My leadership involvement at the academy kind of grew from the ABSM, and I think Larry Epstein kind of encouraged me to be more involved with the academy and to see if I was interested in even perhaps being on the academy board. So I was fortunate enough to be elected to the academy board, and during that tenure, eventually became the secretary treasurer and then the president of the academy in 2011, 2012. Well, over that time period when I was on the board and president, I would say there were a couple of major themes. One was really about testing, so home sleep testing. That was a huge one. And I was involved in many of the early attempts to try to determine whether home sleep testing was ready for prime time. And so there was a Tri-Society board that I was the, chair of with the AASM, the American College Test and ATS, that published a paper. And then once CMS kind of accepted home sleep testing, then I was involved in developing like a technology evaluation of home sleep testing to help people try to determine what testing devices were valid and should be used going forward. So home sleep testing was definitely an interesting issue during my tenure. And now we don't, again, the people that are now, it's just part of it, but there was a whole long trial of getting there. And then the other thing was really how to recruit more people into the field. Certification, like I said, not just MD certification, but technologist certification. Just trying to build the workforce, because we knew the number of patients with sleep disorders was tremendous, and we knew that there were not enough of us to take care of all of them. So how to, try to build that. So I'd like to say one of my proudest things that I did during my tenure was to put together a task force on, advanced practice providers trying to get, figure out, because there were a lot of us that were using advanced practice providers, but there was no real formal methodology for them to get into sleep or training, and most of them did not have a lot of training as part of their program. So we had a presidential task force, and now obviously it's blossomed, and they're just part of all the rest of us now. So I would say those are probably the main couple things that we dealt with. So home sleep testing, originally there was a lot of pushback, and part of it was, I think, what those of us in the field at the time were used to. It's like you just get so much more information from a polysomnogram. Part of it, no doubt, was financial. Polysomnography had really helped build the field, there's no doubt, just from a financial standpoint. I mean, if you don't agree with that, then you're kind of fooling yourself, I think, because it made the field viable, and so there was pushback just from even a financial standpoint. So getting home sleep testing considered more mainstream was really challenging, and there was a lot of give and take. Eventually, it was, I guess, kind of forced. I won't say forced on us, because it had been building over time. And, I think while there was a lot of pushback, eventually, once it started and it was more embraced, we realized that this is not necessarily a bad thing, because it, has probably allowed us to reach more patients. There's a lot more flexibility. And now, with the way technology is moving, it's only going to get better and better. And so while I think during what's left in my career, we'll still be doing polysomnography for many patients, I think a lot of what we're going to do diagnostically will be done in the comfort of a patient's home, and that technology will continue to improve. I am the current editor of JCSM, been in that position since 2014. And honestly, I wasn't involved much in JCSM while Dr. Kwan was the editor. My initial interest in editing actually was generated by my former mentor, Jay Block, who became the editor of Chest. Right around when I was in my fellowship, I think right after I finished my fellowship. And I was like 2 years out of my fellowship, and he asked me to be his deputy editor of the journal Chest. He had 2 deputy editors. So that was just a tremendous opportunity for me. And he, helped me understand editing and reviewing, and was a great advocate for me throughout my career. And so, I became very interested in that aspect. And then Chest is obviously a journal that's broader than sleep medicine. It's sleep medicine, pulmonary critical care. And so when the opportunity, for JCSM came up, it was like the perfect thing, because my career over time had narrowed from pulmonary critical care sleep to more pulmonary sleep to 100% sleep. And so sleep was my passion and my interest. And so JCSM and clinical sleep, really. I mean, I didn't really do bench research. I've always been interested in the clinical aspect of sleep and education, sleep education. So it was like the perfect conduit for me. It was like, this is perfect. I can, be active in a journal, be involved in the journal, and learn all about clinical sleep medicine. So just the whole package. So for me, it was opportunity that, again, I credit Jay with helping me gain the experience to put up a good face and interview for the job. And it was like the perfect job. So I'm happy to got in the position, and I've really enjoyed doing it. Journal of Clinical Sleep Medicine is the Academy's flagship journal. The Academy self-publishes, and so the managing editor, the staff are all Academy staff. We use obviously other software vendors and what have you for the actual publishing and manuscript reviews and what have you. But the Academy has managed it, I think, since the beginning. So my interaction intermittently with the board, and obviously the best part of, I think, as far as the journal, it gets all of the good stuff from the Academy. So all the practice parameters, clinical guidelines, Academy position statements are published in JCSM. And, we've been fortunate that the number of submissions have gone up pretty much every year. And as it has, some of the other things you measure by, the impact factor has gone up. And my favorite slide is that it's the number one membership benefit that this on the Academy survey, JCSM. As far as other people that have helped guide my career and mentored, I would consider mentors. One of the first Academy presidents when I was on the board was Mike Satay. And Mike was, he's just a super nice guy, very easy to talk to, very practical. And he was very helpful, like in many of the projects that I kind of started out in and was involved in, and helping me, just kind of understand the political waves and how to maneuver through things. So Mike, Larry Epstein was also one of, I would say, my good colleagues and mentors, again, being a prior president to me, watching him manage the board and navigate the political waters, probably one of the best at doing that I've interacted with over the years. And really all of the presidents that were president during my tenure, I learned something from every one of them. They all brought something different to the table, and were really instrumental in helping guide my career. When you're president, there's a few things that you kind of have to figure out. And Jerry Barrett was the executive, what would his title be? Executive director. Yeah, Jerry Barrett was the executive director. And Jerry was always funny. He would say, like, when you're the president, it's like a marriage, and then you have to get a divorce. But he, again, was, having done it many times, he knew exactly what to tell you and how to help you manage the task of being a president. So he was very instrumental in, again, just being able to navigate the waters. The AASM is a society that is focused on sleep medicine, but it's also really like a big family where those of us who are passionate about patient care, others are passionate about sleep research, others are involved in sleep medicine in other ways, but where we can all work together, sometimes meet together, and work on current state and dream about the future of the field. When people ask me, like, what do you do? It's like, do sleep medicine. It's always like, there's a field for sleep medicine, particularly earlier in my career. And a lot of people found that either humorous or weird, or but I don't get that so much now. And I think that's because the field has become more mature, and I think that things like, a fancy watch that tracks people's sleep has helped people become more aware of their sleep. There's more awareness about sleep disorders. And so it's kind of been, gratifying to see that progression over my career, and I think that maybe I had a little help in getting there.